Hey everyone, and welcome back. This is Lauren, the medical educator here at the DIS Foundation, where our primary mission is to empower people to save lives by providing healthcare education to underserved areas, both domestic and abroad. Welcome to our webinar. Today we're going to talk about how to perform CPR on a child. So as a reminder, let's just go over what CPR is again. CPR stands for cardiopulmonary resuscitation. It's a technique that combines chest compressions and rescue breaths in order to deliver oxygen to the body when a victim has experienced cardiac arrest. To perform CPR, you need to do the following steps. Ensure a safe scene. Assess victim for responsiveness. Call 911 and get an AED. Check to see if the victim is breathing normally and if they have a pulse. Perform 30 chest compressions. Deliver 2 breaths. Continue CPR at a ratio of 30 chest compressions to 2 breaths until help arrives. Use an AED once it is brought to the scene, and continue performing CPR and using the AED until further help arrives. So let's go over what the initial assessment is. During your initial assessment of the victim, you want to make sure that the scene is safe. You don't want to become another victim yourself. Then check the victim for responsiveness by tapping them gently. Basically, you want to try to wake them up as if you were trying to wake someone up who were sleeping. And keep in mind that the victim may have suffered a trauma, so be as gentle as possible. Then call for help. If someone else is around you, tell them to call 911 and get an AED. Otherwise, call 911 yourself on a cell phone if possible. Check for normal breathing. Remember that gasping does not count as normal breathing. If the child is not breathing or not breathing normally and someone was around to get an AED, start CPR. If the child is not breathing and no one is around to call 911 and get an AED, and you witness the arrest, you may leave the child and do so yourself. If the child is small enough and you're able, consider bringing the child with you. If you're alone and did not witness the cardiac arrest, begin CPR for 2 minutes before going to get an AED. And again, here you can consider bringing the child with you if you are able. So to perform CPR, you need to start with chest compressions. If the victim is not already, move them so that they're lying on their back and make sure that they're on a firm surface to allow for effective chest compressions. You want to deliver 30 compressions at a rate of 100 to 120 compressions a minute. This is the same as the beat in the song Staying Alive by the Bee Gees. When delivering chest compressions, make sure you're compressing the chest at least 1/3 its depth, which is about 2 inches. Allow for complete chest recoil in between compressions, and minimize interruptions in between chest compressions. Try to limit those to only 10 seconds between chest compressions. For rescue breathing, after chest compressions, you want to deliver 2 rescue breaths. And so to do this, you need to ensure an open airway. You can open the airway by performing the head tilt chin lift maneuver. But if you suspect trauma, you should perform a jaw thrust instead. Pinch the nose shut and suction your mouth around the victims, and blow for 1 second, looking for chest rise. If there's no chest rise, try repositioning the airway, and deliver 2 breaths. However, spend no longer than 10 seconds before returning to chest compressions. And when giving breaths, barrier devices such as a pocket mask and a bag mask can be used, and should be used if they're available. Don't forget that we offer online CPR certification on our site. You can find a link in the description, and we encourage you to become certified as soon as possible, either in a classroom or on your own time with an online course. Thank you so much for tuning in, and catch up with us in 2 weeks for our next webinar on how to perform CPR on infants. Please comment below if you have any questions. Thanks. Bye.